We know that healing begins when people feel seen, heard, and respected.
In the operating room, we are trained to control variables, vital signs, anesthetics, dosages, but the patient's experience after they leave our hands, well, that's often where the real story begins. It is our responsibility to think beyond the block and consider how that patient lives and recovers in the days and weeks that follow.
The art of medicine revolves not only around the analysis of pain scores and patient satisfaction as a metric, but also helping patients to maintain their autonomy and minimize anxiety. This philosophy comes to life especially in the post-surgical pain management setting. As anesthesiologists, it's not just about the regional nerve blocks we choose. It's also about what we use to make them the most effective.
Not all nerve blocks are created equal. The technique matters, but equally important is what we inject with those blocks. Long-acting agents like bupivacaine in advanced formulations allow us to extend analgesia meaningfully, safely, and effectively. And that's not just pharmacology, it's progress in patient care.
Exparel is one example of a well-known alternative to opioids. It utilizes a proprietary multivesicular liposome technology, which safely delivers bupivacaine over time for extended analgesia. That is why Exparel has been FDA approved and clinically used time and again in upper and lower extremity specific nerve blocks and fascial plane blocks to provide patient prolonged pain relief as part of the perioperative journey, helping to minimize or even eliminate the need for opioids. I'd like to take a moment to introduce you to John Saladino, a 58-year-old from New Jersey, whose story is one example of quiet strength. He had knee replacement surgery several years ago and had to suffer through unbearable pain. So when he needed surgery again, his biggest fear wasn't the procedure, it was the pain. Hi, John. Thanks for being here today.
Thank you.
I have a few questions for you. What were your expectations going into this surgery based on your past experiences?
Based on my first surgery, I was expecting a tremendous amount of pain with a long recovery and extended physical therapy. I really had no reason to believe surgery would be any different from the one I had 15 years ago.
Every patient brings a story into the operating room, fears, expectations, memories, and those stories influence their recovery more than we often realize. John's experience isn't just a case study. It is a reminder that the choice we make can completely transform what a patient remembers about a surgery and anesthesia.
What role did Exparel or other non-opioid options play in your recovery process?
Exparel completely changed my recovery after the second surgery. The first 2 days were entirely different. I had minimal pain. I was able to enjoy sleep and focus on my recovery. This time around, I actually had my physical therapist say to me, I've never released anyone from physical therapy this soon after a knee replacement. And emotionally and mentally, I would say it gave me a feeling of hope that recovery was within reach.
Early mobilization isn't just a milestone, it is a clinical advantage. And when patients can sleep, move, and engage in a therapy without the fog of pain or narcotics, we are not just speeding up discharge. We are preventing complications, reducing dependence, restoring autonomy, and we are improving the perception of the quality of healthcare the patients carry with them.
How has this recent experience changed your perception of what recovery can look like?
I mean, if someone had told me about this and I didn't experience it firsthand, I probably wouldn't have believed it. But the amount of pain reduction after surgery is life-changing.
As you heard from John, Exparel made a big difference in his recovery. What was that difference? Well, a multimodal plan that included long-acting Exparel and a combination of post-operative techniques with extension of analgesia into the recovery process. He was alert, his pain was well controlled, and he did not only rely on an opioid. John was walking on the same day of his surgery. This wasn't just recovery, it was restoration and function and return to the quality of life that he was anticipating. This was his empowerment factor. Control. Patients like John feel back in charge of their healing. Hope. That first small step, like walking unaided, becomes the spark of renewed purpose. Reduced anxiety. They are no longer dreading the pain that lifts that emotional weight. Identity. They return not just as patients, but as parents, professionals, caregivers, friends. Connection. With more energy and less discomfort, they reconnect deeply with themselves and with loved ones. And you hear this echoed by not just the patients, but also by our nurses, surgeons, physical therapists, all noticing a difference in an opiate-sparing recovery. This continued care loop allows us to gather real-time feedback, adjust care plans, and reinforce that sense of agency patients gain in the hospital. Even Medicare and commercial payers recognize the importance of using non-opioids. As of January 1st this year, there is a federal mandate, No Pain Act, that requires Medicare to reimburse for non-opioids, like Exparel, used during surgery conducted in the ambulatory surgery center or hospital outpatient department setting. Let's be honest, we've all known someone, or maybe even ourselves, who has felt overwhelmed by post-surgical pain. But what if recovery didn't have to mean suffering? Patient-centered approaches, like Exparel, allow us to reframe the entire experience, not as a passive process, but as an empowering one. A process where the patient is not at the mercy of pain, but an active, confident participant in their role and return to life. So I leave you with this. What kind of recovery would you want for someone you love?
As clinicians, we are constantly asked to do more with less. But here's the truth. Better pain management isn't about doing more, it's about doing it differently. If you had the choice, wouldn't you want recovery that gave your patient not just relief, but their life back? That is the question I ask myself every day.
With Exparel and patient-centered anesthetic care, that's what we strive to deliver every single day. Because when we treat pain differently, we help people heal differently. And that's just not a clinical win, that's a deeply human one.
Exparel, liposome injectable suspension, is indicated to produce post-surgical local analgesia via infiltration in patients aged 6 years and older, and regional analgesia in adults via an interscalene brachial plexus nerve block, sciatic nerve block in the popliteal fossa, and an adductor canal block. Safety and efficacy have not been established in other nerve blocks. Important safety information. Exparel is contraindicated in obstetrical paracervical block anesthesia. Adverse reactions reported in adults with an incidence greater than or equal to 10% following Exparel administration via infiltration were nausea, constipation, and vomiting. Adverse reactions reported in adults with an incidence greater than or equal to 10% following Exparel administration via nerve block were nausea, pyrexia, headache, and constipation. Adverse reactions with an incidence greater than or equal to 10% following Exparel administration via infiltration in pediatric patients 6 to less than 17 years of age were nausea, vomiting, constipation, hypotension, anemia, muscle twitching, vision blurred, pruritus, and tachycardia. Do not admit lidocaine or other non-bupivacaine local anesthetics with Exparel. Exparel may be administered at least 20 minutes or more following local administration of lidocaine. Exparel is not recommended to be used in the following patient populations: patients less than 6 years old for infiltration, patients younger than 18 years old for nerve blocks, and/or pregnant patients. Because amide-type local anesthetics, such as bupivacaine, are metabolized by the liver, Exparel should be used cautiously in patients with hepatic disease,